pieces, it's got kind of a groove in the middle of it, but it's all one piece. And so, I mean, just like most things, though, it is symmetrical. Right. So there, on one side, you have a mirror image of the other side.
Right. Okay.
Yeah. So what's next? So we got the pons and the medulla oblongata. Remember that the spinal cord is anything after the medulla oblongata. So as soon as the swelling kind of goes away, and you'll notice on these sagittal ones, they've dried out and they're not as bulky as those are, right? That's because they've actually lost a lot of water. Let me find a good one here.
So they shrunk?
Yeah, they shrunk. So here was our thalamus and our midbrain. So the pons is this little piece right here. And then medulla, you can kind of use the cerebellum as a landmark for medulla oblongata. And then everything past that's the spinal cord. Okay, so corpus callosum, remember that was the roof of the lateral ventricle. So that's this white part right here. See this kind of white part of the lateral ventricle right there, forming the roof.
Which one? Can you turn that over and show us?
Sure,
I can't see that one.
So this right here, this space is the lateral ventricle, and so the roof of the lateral ventricle right here is the corpus callosum. This one's actually kind of split away. It shouldn't look like that. It should be kind of all connected right there. But it's getting older, and you know, you see if you look at one of these, here's another lateral ventricle. You can see corpus callosum there. On the other hand, the fornix is, let's see, find a better one. Here's a good one. That has a nice. See, here's the corpus callosum, and then the floor of that lateral ventricle is the fornix. So this piece right here is all fornix. Septum pellucidum. I'll try to find. This one has a little bit of a piece on it. You see this kind of tissue hanging right here? Really, a freshly dissected one would be the best way to see one, but this one's got it. So see how the lateral ventricle's not open? Mm-hmm. There's that tissue there. That's septum pellucidum, because what's happening is there's two lobes, and that medial wall of the lateral ventricle is formed by that septum pellucidum layer of tissue there. So the septum pellucidum is kind of a thin layer of tissue in the center of those lateral ventricles right there. Okay, so when we talk about thalamus, don't worry about intermediate mass, just thalamus is fine. So you'll look for the diencephalon. Keep in mind that the optic chiasm is your marker for the hypothalamus. So just above the hypothalamus right here is the thalamus, this kind of round body right here, resting inside of the third ventricle.
Can you turn it this way?
Let's see again?
We can't see it.
Yeah, this right here is thalamus. Here would be hypothalamus next to the optic chiasm.
Okay.
So we can't really see thalamus on here, but here's the whole optic chiasm. And so just deep to this right here would be the hypothalamus.